Greetings. My name is Kellie McAlpine, and I am the clinical nurse informaticist here at the Sacred Heart Clinic. I am sure many of you have noticed the renovations around our clinic, and today I would like to take the time and discuss those renovations that will be prevalent within our clinic and how those changes will be benefiting you as our patients. So this slide talks about the objective of our PowerPoint presentation for our patients here at the Sacred Heart Clinic. And we just kind of want to define the electronic health record, describe the benefit of using an electronic health record, define health information exchange, describe the benefit of a health information exchange, briefly discuss the patient benefit of using these new tools that we're implementing, introduce new technology within the Sacred Heart Clinic that will be prevalent, address the ONC policies, and we also want you to know where you can find assistance in case you might have questions or concerns during this transition period to access some of our new tools for your use. This slide discusses EHR, and that abbreviation stands for electronic health record. It's a digital version of your paper charts that I know you're used to seeing us having, but we're actually transitioning away from that and making everything computerized, hence electronic health records. Your medical records are available to authorized users anytime it contains up-to-date information, and we want to emphasize the importance of authorized users. Medical information can be shared instantly and easily with other providers as well as with other healthcare organizations. So that will be great for you guys that are worried about the care coordination with this. You're with the electronic health record. It contains medical history. Especially you'll have office visits, all of that information obtained from your clinical notes and diagnosis that we have on you while you've been in clinic. Your medication history, immunizations, allergies, labs, your radiology images and reports and testing results. And that's all useful information so you can share with other providers and they can easily access your charts as well. The benefit of having an EHR or an electronic health record is really because all the information, all of your health information will be current, up to date, easily accessible, and it's all in one place. And this allows for better care coordination between providers and facilities. It also allows for better diagnosis because all your information is readily available. Efficient care. We'll be able to move along the process for you. There'll be a less chance of duplicate testing or unnecessary testing because all the testing and lab results and everything you've ever done will be right there in one place where all providers will be able to access and view at any time. And this will also allow for a reduction of errors because your allergies will be there, your medication list will be there. So then people are automatically aware because they can quickly access your records to know, like, hey, Mrs. So-and-so is allergic to penicillin, which ultimately leads to better patient outcomes, especially, for instance, if you came into the emergency room or a clinic or anywhere and we had no past history on you, but we could click on your chart and easily access some basic information on you, and that leads to the better patient outcomes. We'll also be able to electronically prescribe and renew medications to your pharmacies that we have on file that you've requested your medications to be sent to. And we'll talk more about it, but you'll also have access to a wonderful tool that really engages our patients, and it's called Patient Portal. This slide talks about HIE, which stands for Health Information Exchange. This allows healthcare professionals and patients to appropriately access and securely share a patient's medical information electronically. This is especially beneficial to patients that have multiple providers. Enriches the patient's care, as all providers will be aware of your treatment plans. The HIE benefits is it allows for better tracking and secure sharing of health information. It helps facilitate care collaboration amongst providers, which is very useful for patients when they have multiple providers, or if a patient finds themselves in an emergency situation, for example, an urgent care or a hospital. Those providers that have access to those EHRs or an HIE systems can quickly access useful information in regards to providing efficient, quality, and fast care. The HIE also reduces duplicate testing or eliminates unnecessary testing, encourages patients to become involved into their own care. For example, you'll see with telemedicine and the patient portal discussion, and it also provides error prevention. This slide is really going to talk about how the patients are going to benefit that are being seen in our clinic here at the Sacred Heart with the use of EHRs and HIE. And really, you're going to see improved patient satisfaction because patients will feel more engaged. They'll feel the efficiency of their care. They'll be able to connect with their providers and the team associated with the providers and get quick responses, i.e. the efficient care. And you'll also get a sense that you're kind of managing your care and involved in there. And it'll be improved collaboration because the records are easily accessible from various providers that are warranted to be looking at and authorized to be within your chart. And overall, you get a better quality of care because it'll be cost saving for you, reducing errors. So the next thing would be the privacy and security aspect of your health information. Most definitely that is a priority here, especially when we were designing and what would fit for our clinic. And that was definitely something that we've brought up with the vendor companies that were implementing this electronic health records for us. And one thing that we have installed is like antivirus software that's installed to help reduce those risks associated with data breaches. In order for anyone to access your charts or information, they will have an authentication signature that would be specific for them. They're not allowed to share that, give that out, or anything. It's specific to that provider or someone that is really involved in your care directly. And we'll also have audits that will be frequently completed to ensure compliance with federal regulations like HIPAA, which are all concerned about the exchange of privacy and your electronic information. So new technology will be prevalent as soon as you walk in, and you'll see the changes at Sacred Heart. As soon as you walk into our clinic, you'll come onto the check-in counter. It will be computerized. You'll be required to take a picture, and that's for your chart identification and safety. You'll also be able to, prior to your appointment, to schedule those appointments or pay those bills. And when you come in to check in, you'll also receive a patient privacy notice, and that'll be provided just to let you know that our clinic, even though it's changing, we're still upholding the values and complying with HIPAA regulations and for maintaining your privacy to the highest standard. You'll also receive a check-in, or if you want to receive a pamphlet for patient portal sign up. And patient portal is just a convenient way that you can securely manage your health from home. And you'll have access to view your medical records and those clinical notes from your office visits as soon as that day. And also lab results, upcoming appointments, and send messages directly to your providers, their staff, and request renewal of prescriptions. Now, as soon as you get back into the exam rooms, you'll notice the EHR in action. You'll notice the computers that are in every exam room. You'll notice that when your doctor comes in your room, he'll most likely have a little device called a Dragon. And that is just a software that allows your provider to continue to provide that efficient care. And it's an electronic dictation device where your provider speaks into those words, get translated right into your healthcare record. In Mostly for our patients that have chronic conditions or live in those rural areas, we provide a service now called telehealth, where we remotely monitor our patients. And if your provider feels that you would benefit from that program, we will set you up at your time of the visit. This slide discusses ONC policy. ONC stands for the Office of the National Coordinator for Health IT, and it's just improving safety and health information technology, and it's really geared around making sure it's a guide for safer EHRs. They actually implemented a guide called SAFER, which stands for Safety Assurance Factors for EHR Resilience. It's a checklist that consists of about 10 to 25 practices that reflect safe and effective EHR implementation. We definitely use this checklist. It was a guiding light for us during our EHR process. Another policy that the ONC initiated was the interoperability roadmap, which makes critical health information electronically available and when it matters. And that's great for our patients and providers to make sure the information is available and transferable. In this slide, we're just showing you that, we are providing our patients, because we all know that not everyone is technology savvy. And we want to let you know that there's assistance being provided during this transition period. Because the ultimate goal in this clinic is to empower our patients and their families. There is a help desk available 24/7 by calling the number listed in the PowerPoint at 404-778-1234. There are available step-by-step simple instruction tutorials available online for you as well. Thank you all for your time and attention, and for your patience with the Sacred Heart Clinic. As we go through this transition, we can ensure this process will be beneficial to our providers, patients, and staff. Have a great day.